I'm glad to welcome you to be part of Comprehensive Dietary Management Program. I'm Dr. Abimbola Onifade, and I'm the convener of Smart Medical Programs. This is the orientation video for diabetes and hypertension. In this program, we'll be dealing with diabetes and hypertension specifically. So our focus for this particular program is type 2 diabetes and hypertension. Then prediabetes often becomes diabetes. So this is part of our focus as well. And most of the people who are diabetic or who are hypertensive are often obese or overweight. And we're dealing with this as well. Also, high blood cholesterol is one of the problems experienced by people in this group, and we'll be dealing with all of these together. Now, in this video, I would like to explain to you what to expect in this program and how you can benefit from the program. Now, the program is free, and the program is going to last for 1 week. Not all of our programs are free. We have programs that are premium programs, but this free program has been designed to help you understand what you need to understand for you to be able to make quality decisions about your health, and for you to be able to deal with the problem of diabetes and hypertension and reverse it. So the aim of this program is not to help you to just control. The aim of this program is to help you reverse. And reverse simply means you are able to deal with this problem in such a way that you don't even need medication for this particular problem again. And this is not a big deal, because as of the time I'm recording this video, we have already dealt with more than 3,000 people. And by saying more than 3,000 people, I just want to be conservative, because really we have reached far more than this. And out of this number, have quite a number of them that gives us great feedback. Many people automatically will not give feedback, but so many people give feedback, and so many people are even on our premium group that we monitor, premium program, and that we monitor, and we're able to see the progress. And believe you me, many people have achieved this goal of being able to reverse diabetes and of being able to reverse hypertension. And I believe you are the next in line. So for this program, the method we deploy is, number one, I talk about video guide. You'll get access to video tutorials like this. In those tutorials, I will teach you different things you need to learn to be able to take your health back into your hands. So you will listen to it the way you are listening to this particular tutorial, and on several topics that you need to learn about in order to win and to be able to reverse diabetes. Now, the second thing you will get is, within this 1 week, is dietary guide. I'm going to give you a quick dietary guide for the first week, and all I just need you to do is put it into action. Do exactly what I ask you to do, then you will see the result. I'm not asking you to pay any money to be able to do this. What I'm just saying is, be serious enough to put it into practice and see if within 1 week you will not see a remarkable improvement. I'm not promising that you will reverse diabetes or hypertension in 1 week, but I'm saying that if you are going to be able to achieve something in another 1 month, in another 2 months, within a week of putting what I discussed with you into practice, you should be able to see improvement. And this will be the proof for you that there is hope for you. So, like I said again, so many people have achieved this, and you are the next in line. Then we are going to have live lectures on WhatsApp. This is usually usually typed, and then we'll exchange chats on WhatsApp and even on Facebook as well. Live lecture on Facebook could be in form of video, and it could also be in form of chat as well. So those are those three methods are part of the method we use in achieving this aim. Then social support on forums. Like I say, on WhatsApp, we'll be giving you support. You'll be able to ask questions, and we'll be able to answer you on the WhatsApp live. This is not a program where you adjust on your own. We support you through the program, and this is why people have been able to achieve results, because we do not just give them a book to go and read, or we do not just give them a video to watch and go and be on their own. We attend to their peculiar challenges even through these forums. So WhatsApp forum, that's the biggest forum, that's the best forum, and that's the easiest forum for most people. Then Facebook group, we have Facebook group as well, and I want you to join as well, especially for long-term benefit. Then we have websites, so we support you through all of this. Like I said before, question and answer on WhatsApp, Facebook, or even on our website. This would help you a lot. So these are the methods that would deploy, and this is great. If we were to charge for this, it's a lot of money. Then on our WhatsApp group especially, we will restrict people from commenting from time to time. So please take note of this. Anytime you see that it's only admin that can send a message, don't be discouraged and don't think you have been abandoned. The purpose of this, especially within this period of 1 week, the purpose of this is to avoid spam. Some people send some nasty messages, especially on WhatsApp group and the rest like that. So to avoid this and to avoid too many comments, so that every person can have access to the main content. Some people probably will be at work when we release some content, maybe in form of written or maybe in form of links to video. So if we don't restrict it, there will be too many comments before they come back, and probably you are able to see it, but they will not be able to see it, or possibly you are even the one that this will benefit. So try and understand this. This is one of the things we will do. So we will always open the floor for questions and answer. At least we'll open the floor probably in the evening, but that doesn't mean we would not be opening the floor even for 24 hours. But when we recognize this kind of a problem, this can happen. We can restrict people from commenting from time to time. It doesn't mean we will have to do it. So when you see that it happens, please don't be discouraged. Just stay on the group. And if you have any pressing or urgent need, you can always send a personal or a private message. If it is not urgent, please, if the group is restricted, wait till it is open again. Then a form will be posted to the group for you to fill. This is optional but recommended. The purpose of this is that if we are going to work with you, we'll be able to know where you started from. And this is very important because you will actually need us for this. So please, I advise you try as much as possible to fill the form that will be posted on the group. But this is entirely optional, but it is recommended that you do so. And how to get the best out of this program? You must be patient. So I said patience. You must be patient. Some people, when they join groups, especially our groups like this, they just want to know everything on a single day. This is not possible. You try and understand that I am also human like you, and every other person that works with me and works with us in this group are also human like you. So you must be patient. This is a week-long program, and most of the questions you might have is already captured. So if you have some questions, I will say please be patient. We'll address it as we go on. Just be patient, and just be patient in everything you do. Just be patient with us. Please be patient, because you are going to address everything. For you to get your head back in the way we have been talking about, you will need to be patient. Then the second thing is diligence. You should take out time to watch all the videos we release. You should take out time to read all the posts that we make there. Even if some people are making comments, you will see whichever post that I made or any member of my team makes, they will be very distinctive. So you can read through. Even if there are 200 comments, you can read through. So diligence. This is not a quick fix. You have to be patient and you have to be part of the program. So you have to be patient, you have to be diligent to watch the videos, you have to be patient to read through our discussions on the group, because aside this, there is no way we'll be able to help you. You also have to have a positive attitude. Positive attitude. Be positive. Be sure that this is possible. Don't have a negative attitude about this. You are probably hearing that this is possible for the first time, or maybe you've been hearing it before. Maybe you've tried different method that it has failed you. This is free for you. So be positive and then put it into practice. Then have a positive mindset as well. If you are the type that thinks that anything that comes to you on the internet is fraud, you are going to have a hard time living in this generation that we are into. The main thing you should be able to do is to discern. People defraud people physically, so it's not a surprise that people defraud other people on the internet as well. Not everything that comes on the internet is a fraud. Many of the things that come on the internet are not fraud, and that is why you are even able to join this program in the first place. So have a positive mindset. Then, if you are going to get a best out of this program, you must be able to take instruction. What to do? Just do what we ask you to do. Do what I ask you to do. If you know better, you shouldn't have been here. But if you are here now, then do what you are told to do. Ability to take instruction is one of the most important thing you will need. Then again, you involve any family and friends that can support you. Not every family and friends will be able to support you, but if you know anyone that will be able to support you, that will be able to help you with anything, please involve them. Then gratitude. Now, we are giving out this program for free. What we expect is gratitude and not abuses. And if you think that you don't want it, then you can just check out of the program. Now, you should understand, like I said from the beginning, we have free programs, we have premium program. Premium simply means what you pay for, but at least this is free for you. And even when we introduce any program that you can pay for, it is not compulsory. So what we expect from you is gratitude. Take this program, this free program with gratitude, and apply it to your life. Feel free to apply it because it's going to bless your life. So what you should keep in mind is that the program is a scientific and not alternative medicine program. This program does not deal with supplements. This program does not deal, we don't give you any drug, we don't give you supplements. This program gives you quality information that transforms your life. And the biggest part of the program is dietary. The program is also not a quick fix. You cannot reverse diabetes or hypertension in 1 week, but you can see remarkable improvements in your health generally in a week. So if you do what you think that is correct, contrary to what you are directed to do, don't be surprised if you do not get any results. And you will need to make dietary sacrifice, but it is for your health and it is not difficult to make. And you can't be here and there. Just choose where you want to belong. If what you want to do is to be taking supplements, you can go ahead and do that. But if you want to be part of this program, please be there fully. We don't deal with apps, we don't with these supplements, and we help you to get off medication. We don't even add to your medication. The only thing you can expect in this program is to get your medication reduced, not for us to add to it. Then you will record improvement during this free program. But you cannot reverse diabetes or any reversible disease, and also hypertension as well. Sorry, I omitted that, within the short period of time. Now, I want to advise you to join our premium program. Premium is what you pay for after this free program. Like I said before, this free program will deliver to you quality information, great information that is going to be something practical and useful for you throughout your lifetime. But of course, we have a premium program that would give you much more than the free program can do. Then the big picture for this program is what we are working towards is to get you off medication. And we don't just say stop medication. I don't just say you should stop your medication. You will record improvement, and gradually you have to lower your medication until you will not need the medication again. Then even within 1 week, you will see that your health has improved, your parameters has improved compared to what it used to be, and that's if you do what you are told to do. So we want to keep your fasting blood sugar less than 100 milligram per dl or 5 millimole per liter. Then the 2 hours after you eat, especially after breakfast, less than 140 milligram per dl or 7.8 millimole per liter, and your hemoglobin A1C between 4 to 5.6% always. So that is the big picture. We do not say this in assumption. This is scientific, and like I say, it's going to be gradual. Then want you to keep blood pressure within normal parameter as well. Usually, we want your blood pressure not to be higher than 120/80 millimeter of mercury. But the first target is for it to be less than 140 millimeter of mercury. So when we achieve that, of course, we are achieving something big, and eventually we'll work towards the goal of keeping it less than 120/80 or not more than 120/80 millimeter per mercury. Then want to keep your cholesterol within normal range. We'll deal with this cholesterol in details in the premium program actually. Then other goals is to prevent and deal with complications. Diabetes leads to serious complication. The same thing with hypertension, it leads to serious complications. Then high blood cholesterol leads to serious complications like heart attack and so many other problems. So this is what we want to prevent. In as much as we are dealing with the problem you have, we want to prevent the ones that could happen as well. And trust me, we need to do this, and you need to comply in doing this, because diabetes causes all what and not problem. Hypertension causes all what and not problem. Then we want to prevent chronic diseases, the ones you don't have, so that you don't eventually have it as well. Want to help you be in healthy weight. Some people are thin outside and they are fat inside. They are fat clogging all their internal organs. So if you think your weight is healthy, fat might be right inside, causing serious problem for you. So want to resolve this as well, and want to resolve the problem of food addiction. Now, if you are watching this video, please, I want you to if you are watching this video on YouTube, what I need you to do now is to subscribe. You see the subscribe, there like a red button written that with subscribe written on it. Just click on that. By doing that, you would have subscribed. Then you'll see a bell that will come up after you subscribe. Click on the bell. Anytime I release a video like this, even if it is not related to this program but related to your health, you are going to get it automatically when you do that. So please do that, and like this video as well. Then like this video as well, please. Then the next thing I want you to do, if you are not on any of our WhatsApp group, then go to www.smartmedicalprograms.com/WhatsApp. Then join the appropriate WhatsApp group there. You'll see it there. Just click and join us on WhatsApp. But if you're already on our WhatsApp group, please don't do that again. There is no need to do that because you're already with us. Thank you for taking our time to watch this. I'm sure that this has blessed you, and I'm expecting that you put your all into this program, and I want to assure you that you are going to get your health back. You have nothing to lose. All you just need to do is to take action. Thank you.